So let's talk about COVID-19 and the effect it has had on our economy, and especially at the county level. So we know, that's what we've been discussing as we're beginning the conversation with Njiro Gekonyo in the previous hour. We talked about the kind of effects that we've seen with COVID-19. More than 1.2 million jobs lost during this COVID-19 period. People getting into financial distress, and this is also just amplified by the fact that we are seeing the amount of money that people have borrowed during this time on these mobile lending platforms. 345 billion shillings is just what was recorded a couple of weeks back. We know how, and this is not just in the urban areas, even in the rural areas, there's a lot of financial distress, there's a lot of economic distress, and people basically need a government to then refocus and re-strategize and decide this is what we need to do to recover from this. What is it that can be done immediately to spur economic activity, so that people can have money in their pockets? So that then you can also look at other social protection issues. There are people who, the people who are already on the social protection, you can imagine the government was supplementing their income by giving a little amount of money for those up over 70 years of age. But the rest of the money was basically coming from support from family members. Now, if those family members have been affected, then you can imagine the 70 and above. You can imagine the persons living with disabilities. What is it that they are facing? What is it that they are going through? So there's a lot of that's happening. And the Council of Governors, cognizant of this fact, then decided, let's form a committee, let's look at what is it that we can do as counties to come up with a recovery strategy. And so they came up with the socioeconomic re-engineering and recovery strategy that's going to cover 2020, 2021 and 2022-23 financial years. All right. And so Professor Nyong'o, the governor of Kisumu County, is the leader of that team that had other governors, including the one for Laikipia, Derito Mureithi. And they came up with this now. It's basically embedding response, recovery, thriving. So it's about just kickstarting livelihoods and in the economy. What do you think the main areas of this should be? What should it be focusing on?
Well, if you're talking about jump-starting an economy, you first of all want to ask yourself, the counties you're speaking of, what is it that is the bedrock of their economy?
You're right.
What is it that they do? What are they best poised to actually do economically? And then, from that point onwards, you look at their manpower, the available manpower, and you look at their manpower development plans. In all honesty, it's something that arguably the counties are perhaps best placed to do, because they would know what it is that they can do best and what it is that they can thrive in. Yes. But as to whether the stimulus response activity would actually work, I think that is something, the proof of this particular pudding would be in the eating. You start it, but with an idea of knowing, the knowledge that perhaps it has worked elsewhere, perhaps the little tweaking, it could work for you.
Yep.
But you cannot fully understand this unless you start it off. You have to begin it.
You've got to begin somewhere.
You have to start it.
And it's a good thing that, the governors then decided, let's do something. Let's come up with that. Let's begin somewhere and let's work out, come up with a strategy. And then now going to discussing it, thrashing it out and implementing it immediately. But remember, we're in an emergency.
Yeah, but also making sure that the people have buy-in, because if no matter how good it is, if you don't take enough time to ensure people understand what it is and how it is, they can actually embrace it, my friend, you will start it and you will tank even before it has even had time to take off. Because people will not have bought into it. People have to buy into the idea. If they don't, it will not work, no matter how good it is.
It'll just be your strategy.
It'll be your strategy and it won't be theirs. It has to be theirs.
So you've got to go to the people and make them understand that this is what we plan to do.
Yes.
This is what we want to do. Even get their feedback from it and let them tell you, okay, so with this we agree and this is how we can implement it at the local level. And then this is the kind of support that you can give us. So then they feel that it's their recovery strategy. Then you're all working together towards recovery.
Yes.
And without that, then we have a problem.
It will not work.
If you look at some of the areas that they say that they're working on, so like the pillars for recovery and reengineering strategies, they look at boosting the private sector activity, strengthening ICT capacity, human resource development, policy, legislative and institutional reform, strengthening the county government preparedness and response to pandemics and disasters. Sometimes you ask yourself, but this is what they've been doing on a
On a
everyday
regular
basis?
No.
No.
If it had been done on an everyday basis, this discussion would have been different. It means the plans may have been there, the benefits may have been understood, but the people on whom or with whom you're implementing it don't share that same perspective. So it appears like you're trying to implement something, but it isn't really going anywhere.
It's just not being done.
No, it's not being done in the way that it would produce the results that you anticipate.
Let's bring in the governor of Kisumu County, Professor Nyong'o. Good morning, Prof.
Morning, how are you?
Mzuri sana. Good to have you on the show. Welcome to the Situation Room.
Thank you.
So, Governor, let's talk about the recovery and re-engineering and recovery strategy. Just looking at some of the areas that you've covered here in this one. Pillars for county recovery and re-engineering, among them boosting private sector activity, strengthening ICT capacity, human resource development, policy, legislative and institutional reforms, strengthening county and government preparedness and response to pandemics. And we just went through this just now briefly, and we asked ourselves, okay, but this is what counties do on a daily basis. How different is this going to be now with COVID or post-COVID?
Well, what you must understand is that the COVID experience dislocated county economies and national economy. Just the mere shutdown of the economy meant that certain goods are not flowing freely across the country. Means that certain lines of production were not on. And when we're talking about the private sector, please don't just think of the big private sector. That's the problem that you make. Private sector also exists in rural areas, small shops, transporters, the market women who buy goods from the big markets in Kisumu and transport them to the small markets in the villages. The prices that might be affected because of the lack of goods, and therefore when the goods are scarce, economics will tell you that prices go up. And when there's scarcity and the points of production dry up, you have to stimulate them. So I think this is the context in which we are talking. If I give you the example of Kisumu County, during the lockdown, there was very little food in the market because the food used to come from across the borders. And once the borders were closed down and things were not working, that food was not there. That means that you learned one very big lesson. That when it comes to the basic household goods, this basic food in the household, we had better begin stimulating household economies in case another COVID strikes us in the future. But for the moment, that lesson is learned, and we need to deal with it now rather than wait until it's too late next time.
Let me just cut in here, Governor, and just interrupt you, because we need to, I think, switch on from a video interview into a phone interview. We're having issues with just getting the clarity of audio, and as we're switching over, as John is sorting that out for us. City, you've heard what the governor is saying. Basically, is there are things that need to be done. There are things that have been worked on before, but we need to look at it from a different angle. Now we have a situation. This is a COVID-19 situation. We need to talk about re-engineering the thing that we've been doing. We need to talk about recovery.
Yes, and he is right, because essentially what you're trying to say, well, what needs to be done here is you need to reject the way people look at these problems. The problem may seem the same, but the circumstances and the situation around which these things are occurring is now different. So the old ways of doing things may not necessarily work, even if they have worked in the past. Right now, because of the situation that people find themselves in, everything has to be rejected differently. Yes. Expectations also have to be re-engineered differently. Because again, things are not normal. You're not doing things the way you did them before. Everything has to change. And for this to actually be effective, people have to change the way they look at it.
Sure.
Not the way they do it, the way they look at it.
The way they look at it, and then even going then towards operations, because I tend to think, I look at this and truth be told, a lot of the interventions that would take place recovering from COVID are financial. There is money that would be spent. There are financial initiatives that then would be created to basically boost, whether it's the economy or boost individuals then who are part of the economy. And I really think and would really hope that a lot of counties who would essentially then depend wholly on the national government in the disbursement of funds would start being innovative and creative in terms of creating financial or financing inducing activities to make sure that you have a little bit more float to get things done in the county as opposed to waiting for national government. I think there should be initiatives that going towards creation of funding. It should be the case as opposed to waiting for the national government to give all the time for everything that you need to do.
But that has to come in. You know why? At the end of the day, part of the problem that counties will tell you they have is that very same issue of the national government never giving them money
Exactly.
which is due to them at that time they should receive it. So there's always a backlog, and which means there will be a backlog of activities, and which also means there'll be a backlog of results that are anticipated.
If the normal things that you're meant to do at county level don't get done, so here you are and you want to introduce something new, which requires, or even if it's not new, something that is going to be in support of something that was there before, it still requires finances. On top of what was normal, you're still not getting. So it seems to me that now innovation needs to come in to make sure that you're able to well, number one, fill up the gaps and then introduce something new. So it requires, you're very right, it requires thinking. It requires changing the mindset or the mind whereby you're waiting all the time for Big Brother to give you something. It's about time people now started thinking about these money-making activities within county.
But you see, that's where now it comes in, because if you talk about now that is own source revenue, and you're talking about boosting own source revenue, we'd come to what one of the things that this re-engineering and recovery strategy is dealing with, which is boosting private sector activity. Boosting private sector activity, what does a strategy have? Enhance access to affordable credit, provide for work sites, that is developing adequate cluster-informed and well-equipped work sites, where those things that we've been talking about, so that SMEs and startups can go and thrive, improving infrastructure and security. This requires an investment by the county so that then you can expand the opportunities for the private sector to thrive. If it starts from you're not getting adequate resources at the time that you require those adequate resources, then you're already in a fix. And the governor of Kisumu is back on the line with us, and now we're just going to have a fun conversation with him. Governor, welcome back. So, look, we are now talking about, what it is that you'd require to do. And the challenge that we are discussing here is, one, the money that you then need in order to be able to jumpstart or to boost some of these activities, like the issue of boosting private sector activity. There's budget reallocation and budget disbursement from the National Treasury to the county. So then the counties are able to, for example, provide for work sites. How would you be able to develop adequate cluster-informed and well-equipped work sites with workshops, common user facilities, incubation centers, showrooms for artisans, and providing machines and safety gear if you don't have the money? Where would the money come from?
Well, look, let's get one thing clear. Life is not always, an instant cup of tea. Things are done in processes. There's the beginning, there's the middle, and then there's the end. What we have done in the recovery process is to set goals, things we need to do to make sure that the economy wakes up after the COVID slump. Because we know for certain that during COVID, many things did not work because of the shutdown. The normal markets were not working because we had to put people in open spaces to trade. Goods were not arriving because borders were closed. And therefore, people have to learn that there's a lot of time lost, a lot of money lost, a lot of opportunities lost. And these have to be restored. That is a must. How we do it, under the difficulties in which we do it, that is a reality. But that should not stop us from doing it. When you come to this issue of revenue coming to the county in time, it is a problem. For example, when there was this crisis or the question of revenue in the state, we did not get money for 3 months. But some of us made arrangements with the banks to borrow and let activities continue. That now must be institutionalized so that borrowing from the banks does become a penalizing exercise. Those are some of the things we're discussing here in Naivasha during the BBI to find out how from now on we can stop this practice of disbursing money to the counties late, because it hurts county economies, it hurts the national economy, because Kenya is made up 47 counties. If they are hurting, the national economy is hurting. It's a joint exercise between us and national government to understand that recovering from the slump of COVID is not just a national government affair. It begins from the grassroots where county economies are planned and implemented. That is the philosophy.
What about income generating activities? I'm really looking at this as an option. I mean, because if you talk about, money dispensed from the national government coming with delays, and then counties having to go to lending institutions to make up for that time, where do income generating activities play a role here, or do they?
Any government must have income generating activities. Any government, whether big or small, must have basis of revenue based on taxation, license, and so on. And for certain, it goes on in the counties all the time. If you look at the finance act of every finance bill of every county before it becomes an act of the county assembly, it lists sources of revenue for the county. You are taxing those people who are mining sand and stones and so on. That's a source of revenue. Their market fees, that's a source of revenue. Their rent and land rates and so on, those are sources of revenue.
Are these enough? Are
What
these
happens
sufficient
is
sources?
that can I finish, please?
Sure.
Please. What happens is that the collection of this revenue may not be efficient. What we need to do as counties to ensure that revenue collection is efficient through using ICT so that the human error does not interfere with the efficiency of revenue collection. Now, one of the things that we want to do in the recovery process is to ensure that digitizing the economy in the county is carried to its optimum level so that it becomes an enabling activity for efficient revenue collection. And let me remind you that from our study that we have done, revenue collection in the county is not that bad. They're better than KRA in certain places. So this pessimism about county inefficient revenue collection is perhaps more dogmatic than realistic.
Governor, when you say that the revenue collecting systems within the counties are sometimes better than that of the KRA, let me just ask, could you highlight so that we understand which some of these areas are?
Let me tell you something. For example, counties which have established, their automation of revenue collection, collect revenue as well as hold my centers, by the way.
Yes.
For example, e-commerce in Kisumu County is working very well, and it's working in many other counties. And we shall produce the data, by the way. When we give you county by county economic survey that we've done, that indeed there are certain areas of revenue collection where some counties are done very well. It's not that bad. But that doesn't mean that everything is rosy. Of course, we must improve. There are lines where we have to improve. For example, in our case, outside advertising has not been bringing us very good revenue because of corruption in the way it is collected. That must be improved.
Now, alongside this, if I may ask, there's this concept of public participation with regards to the county or the government informing the people about transparency in its activities. In this plan that the counties have, is there a plan for ensuring that people understand what it is that the revenue collected from them actually gets to do for them?
You only need to look at WhatsApp groups in counties to understand that people are very, very, very much aware of what is going on. And through the internet, they participate effectively. And by the way, in the implementation of the ICDP, in the CIDP, County Integrated Development Plan, you cannot pass those plans before you have full public participation and before the CIDP goes to the county assembly. When it goes to the county assembly, the MCAs themselves take it back to the awards for the people to discuss it and approve it. This is structured in the County Government Act. This is structured in the various the laws governing the expenditure of public resources in the county. And there are certain bills that you cannot take to the county assembly before you do full public participation.
Why I ask is because I believe if participation as you presented is actually done, then it becomes less difficult for the citizens of the counties to follow through whenever the county government has something that they have in mind and something they'd like to participate in, because they then feel they're part and parcel of the process. This is really my thinking.
I don't think so. Having been a governor for 3 years, I really don't think that's true. Because, for example, I issue state of the county address in the county every year.
Yes.
And by the way, it is received in every sub-county.
Yes.
I need to invite you to the next State of the County address, which I'm going to do on the 24th of November, to see exactly what happened. So I think that we should be much more realistic of what happened in the counties by going deeply, practically, and finding out, following processes in each county to find out exactly what goes on in there, rather than making general statements which are not supported by facts.
Our hosts every day, your hosts, Siti Muga, Nduoko, and Eric Latif. This hour we are talking about counties and their plan for recovery and re-engineering of the county economies after this COVID-19 pandemic. And we're speaking with Governor Nyong'o, the governor of Kisumu County. Governor, as we were going into the break, we were looking at the various aspects of the strategy and you're talking about, the reality we've got to face. And it's true, it's a reality we've got to face. Looking at some of the the contents of the strategy in terms of the pillars of the county recovery and re-engineering, looking at how you intend to support key sectors, including agriculture, including transport, tourism, health, education, and also looking at social protection. You mentioned the County Integrated Development Plan, the CIDPs. I have a feeling that if we went to the county's CIDPs right now, we'll find a lot of these items that have been listed here as projects that should be undertaken and development projects that should be undertaken by counties are already contained there. Why is it that they haven't worked, and has the strategy sought to understand why they haven't worked so far and what it is that would make them work in this emergency time?
Precisely, because what our team was doing was to have conversation with ministers. Let me call them ministers because these are county executive members, rather complicated. We had conversations with relevant ministers in every county. It had something to do with agriculture. There was a Zoom meeting with all the ministers in charge of agriculture to find out what kind of problems we have faced in implementing their strategy, what kind of achievements we have had, and what kind of proposals they may be making now to tweak things differently given the experience with COVID. So we are not assuming that all stated projects have been smoothly implemented. We are aware of the fact that there have been problems in counties. Some of them may not even have been implemented, and some of them may be implemented if they are now tweaked differently, given the circumstances obtaining in counties at the moment. So when we talk about re-engineering, we are saying that we are beginning from what we know has been happening to what we think ought to happen if we have to come out of this crisis imposed on us by the COVID experience. Now, of course, the experiences will be different from one county to the other. One shoe may not fit all. If you are dealing with the pastoralist communities, for example, their issues of recovery are a little bit different from communities who are purely agricultural. If you are dealing with a community like mine, where the economy is substantially influenced by the blue economy, you have to take that into account and find out under these circumstances, if you had a plan to upgrade the blue economy, is there something you need to do differently now that will respond to the reality much better? If you are last example, we as a county are a rice and sugarcane growing economy. Both sugar growing and rice growing has been in crisis for a long time. And now we need to find out whether, as we are recovering the sugar industry under the leasing program proposed by the government, are there opportunities we can seize to make sugar production with subsistence agriculture that makes life perhaps much more livable by the sugarcane farmers? The rice farmers, for example, have not in the past enjoyed the opportunity of value addition in rice. Can we now reorient our CIDP in Kisumu County to invest more in value addition in rice, and what will that cost? Those are some of the practical questions each county must ask itself, and at the Council of Governors level, we have to provide a framework for posing these questions and answering them constructively, county by county.
And as now, I'm looking at what you've talked about, going county by county, and also going back to say that one situation in one county is not for sure the same across counties. The situations are not the same. Having come together to say something needs to be done, there need to be activities then that are essentially going to wake up these mini economies as we see them as counties. Can then the same measure be applied across county, taking into consideration that the situations are not the same?
But exactly, that's what I said. The same method cannot be applied. But even if the same method cannot be applied, it doesn't mean that you cannot think of measures that can be applied differently. I mean, look, the methodology may be the same, but the practical application may be different. So we are talking about methodology, re-engineering. That's a methodology.
Okay.
Restructuring. That's a methodology. But then how do you restructure from one place to the other? What is it that you are restructuring? With what kind of outcome you're expecting that restructuring to come? These are the questions that we are asking. And we did pose these questions counties by county. We have been able to come out with recovery programs for every county, notwithstanding the fact that we have also an overarching, overall strategy for all counties. You see, that's no rocket science.
Your Excellency, let me just ask this question. When you look at the plans that you have in place, you certainly must anticipate a success rate. What do you anticipate and over what period of time?
I've not asked myself that question, but I expect there will be successes and failures. This is the reality of life. And if there are failures, then we'll ask why did we fail and how can we correct the failure. I don't think that we should be afraid of failing. It is better to fail and learn from the failure than not make an attempt at fault. Yeah.
Why I ask this question is this. If I look at, and you've painted a very good picture here, you see the strength of any economy in any county is very much determined by what it does best, what it thrives best in. And if COVID has affected this thing very, very directly, then that recovery plan might take much longer than anticipated. And you're right in saying that you have to try. But even within that context, I'm not trying to put you in a box. I'm simply saying, even as you learn from the lessons that you will derive from implementing, is there a time span within which you hope to at least achieve something?
Obviously. I mean, plans are usually annual. There are long-term plans and short-term plans. When we did economic recovery strategy for wealth and employment creation in the Ministry of Planning many years ago, we had a 5-year strategy which worked actually. But we also realized that we need that 5-year strategy. We should think of a longer vision. This is how Vision 2030 came about. Now in the counties, we have been forced to have a short-term planning because of COVID, because at least a quick recovery. But while we are doing that, we shall continue the discourse and find out, is it possible to have a longer-term strategy for counties, especially given the discussion we're having the BDI? We may not have thought of long-term strategy for counties before, but maybe it is high time we did so.
But in this particular case, Governor, we are coming out of an emergency which has really disrupted a lot of livelihoods, a lot of operations, even in the governments. So what are the short-term gains that you hope to see, and within how long? I'm assuming that this would not
Let me give you one example.
Within a year.
When we talk about, for example, restoring the household economy in a place like Kisumu, we are talking about a year, and we have started already. How did we start? We realized that the long rains are here. The farmers are poor. We got money, about 10 million shillings, to buy seeds for planting vegetables, which get ready in 3 months. So there's an intermediate intervention by giving farmers seeds to grow vegetables, which are for household consumption, and some extra one will go to the market. We are also establishing an exchange market in Kisumu where they can bring the extra produce and they're given money. That produce will be put in the open market for those who want to buy it. So there are such targeted long-term strategies that counties will have to adopt depending on peculiarities of each county. In the case of Kisumu, we have taken the issue of strengthening the household economy by buying farmers seeds, both for vegetables and other crops. In the rice belt, we have decided to buy a new rice mill, which will add value to the rice instead of selling paddy rice to Uganda as they are doing now. That would give more money in the pockets of the farmers, something they've not had before. So these are the things that will come out of these short-term interventions in the recovery process, and we encourage them county by county, depending on the economy of each county. I've just given you the example of Kisumu County, which is going on at the moment. I launched it last week. It's a practicality. It's not just something in heaven.
Please go on.
These interventions take place alongside the normal work of counties. I mean, there's still things that need to be done as normal. These interventions come as a result of things that may have happened because COVID came into the situation, and would be things that need some kind of finance. Where would that come from, and how would counties be able to handle the financial
finance
burden?
must be looked for. I mean, look, there are many sources of finance for counties, for example. There are donor funds, okay? And I give you the example of borrowing money from banks, which counties like mine, who are credit rated, can do. They are the usual divisional revenue bill. Their money is from own source revenue. So sources of money are there. The question is, what is the quantum of this money they're talking about? That is where the problem is. Is the quantum big enough to finance the recovery process? That is the question we must ask. That is the dialogue we must have, both
Is
by
it?
our different,
Can we ask it now? Is it?
and the national government.
It's not enough.
The money is not enough. Even in your household, is money ever enough? So that shouldn't stop you from doing something. It's never enough, but you must look for it.
So as this strategy is being rolled out county per county, is there a timeline within which, for example, each county must come back to the Council of Governors and say, all right, so we've looked at this and we've reviewed internally, and this is what we now are saying we can roll out in the short term, 6 months to 1 year, and then 1 year going forward. Is there any sort of peer review mechanism that's being set up with the implementation of this?
Sure. In fact, we're just setting up a peer review mechanism at the moment. For the first time, there's going to be peer review mechanism in the counties, borrowing from the NEPAD experience. We are doing this in conjunction with the NEPAD Secretariat in Nairobi. That is something something very noble in counties, and I think it will help us. It is rooted in the Council of Governors.
Okay. And the other issue that has obviously come out during this COVID pandemic is the lack of adequate preparedness by the county governments to deal with emergencies such as pandemic, epidemic, and the other emergencies. And I see it's also contained in this report. What exactly is it that counties could do or should do so that they are prepared better? We're not just talking about health emergencies. We are seeing rains in the country. We know there are counties where when they see rain, they expect floods. This has already been happening. We know there are counties where they are already witnessing the return of locusts. So what is it that counties are doing then to boost their capacity for preparedness?
Well, even the national government wasn't prepared, by the way. That's why we had a joint action with the national government. For the first time, we have had 7 summits with the president. Usually the summits are only 2 or none at all.
Yep.
So even the national government realized that preparedness is necessary. We have to have a dialogue with them. So in terms of emergency, nobody will ever be prepared for an emergency. Emergencies are emergencies by their very nature. You can never be prepared fully for them. But one thing we have learned is that at least there should be certain institutions, both at the county level and national level, which deal with emergency preparedness, which will have to put in place certain measures to deal with any emergency which come when they don't want anybody.
Right.
Yeah.
How should those be coordinated? For example, when you talk about now emergencies, at the national level, there has been talk forever. In fact, there's been a bill in the National Assembly on National Disaster Management Authority. And, how that could then be scaled down into the counties. Is this a conversation that is now being revived, or is it just, one of those conversations that happen in boardrooms, but practically it doesn't move? And why is it that it doesn't move?
The conversations have always been there because Kenya, as you know, ever since independence, has dealt with many emergencies. The first one was the Shifter War, which people didn't know it was coming, and it took the government I would say it passed down then.
Yeah.
But finally, measures were found to deal with the shift of work, and it was dealt with. And the county settled back to what may have been normal. After that, there are many other emergencies that have occurred. Floods, for example, in the case of my region, floods have been a perpetual menace to the county. But fortunately, this time, we are building the Kuru Soin multi-purpose dam, which has been in the books since 1951 in colonial times. Finally, it's being put in place, and that will deal with the issue of floods, perhaps much more comprehensively. So, what am I saying? Why am I saying these things? I'm saying this thing because there is no one theory from which we can draw and find a methodology of dealing with emergencies globally. There's no one theory. Yeah. So there will always be a problem in emergencies, by the way.
It's true, but Prof, I think you're just...
Be it locust, be it thunderstorm, be it whatever. But all I'm saying, there must be institutions in place that deal with emergencies. That is why that emergency and disaster bill was mooted in Parliament. That's why many counties like mine, for example, have emergency or county disaster bills or laws. And we set up departments to deal with disaster management. Because we know that there's one disaster we have to deal with every year, that is flooding. Fortunately, now we will not have to deal with it in the same way, but that doesn't mean that the Department of Disaster Management will fold up.
Prof, you speak very well, and you speak very well in terms of, in theory, like you said, these are things that you cannot anticipate, but also these are things that you ought to have institutions that would be able to respond swiftly. So why is it that we don't have them? Why is it that we still have situations where at the national level we have floods ravaging people in the country, we have early warning systems, we have an institution like the Kenya Meteorological Department that's been there for long, but we still are not very good at responding to disasters? Why is that?
I wish you could ask that of the American government, for example. Why is it the U.S. government has never been able to deal with fires in California every summer? Okay, why? Yes, it's a highly technological society. It has very good meteorological services and so on. Why? I mean, it would be very interesting if you could get an answer from that in the U.S. Then I can answer it.
Indeed. It's the
believe
nature of it.
You.
But you see,
Prof.
No.
Yeah, that's what I'm telling you. Believe you me, that the reason why we cannot have a complete solution to emergencies, because every time they come with new dimensions. Even flooding doesn't take place in the same way. You cannot lock up your resources, lock, stock, and barrel, and say these resources are locked up here, they're waiting to deal with emergencies. That's not very good economics. So what you do with the scarce resources you have, you use for doing other things. And in the case that emergency strike, you do your best to deal with it. So there are always scarce resources in dealing with emergencies in any part of the world, including the U.S.
Indeed, that's true.
Yeah.
In fact, if we look also at the kind of emergency that we're dealing with now, the COVID-19 emergency, and how counties responded in the beginning, there has been a very drastic improvement in how the governments have responded. However, we are at a position here now, about 8 months down the road, where we are seeing an increase in the number of people who are seeking hospitalization, but counties are running short of beds. Is it because of the nature of the evolving nature of this pandemic, or is it some lack of capacity somewhere? Maybe financial capacity, maybe technical capacity.
I wish you read the stories. I wish you read the stories of how the Italians, the British have been dealing with COVID. Everybody's running short of beds, by the way. Not just Sumo, not that in Siolo, not that in Mombasa. The very nature of this emergency is that you are likely to run short of beds anytime, because you don't know from day to day how many people are going to need those beds the next day. Today there may be 2, tomorrow there may be 100, because nobody knows how these things strike people. Nobody, including Dr. Fauci in the U.S.
But the one thing you do know, for example, is that it could be. So in terms of preparedness and saying, could we have some extra, I think that's the question now, in terms of
And the
making sure that
answer
in
is
terms
that
of making
counties have done
sure,
very well.
just hold on so I can ask the question. In terms of making sure that there is availability, should something happen, is it not possible to put those in place? And anybody around the world could ask that question. But since we're in Kenya now asking the questions about how it affects Kenyans, isn't it possible to have something to fall back on, because you don't know what would happen tomorrow?
But let me tell you that. I will tell you that the counties and national government have responded pretty well to this thing, given the dimensions. I will tell you, from where I stand in Kisumu, we have responded very well. We have not been overwhelmed by bodies like elsewhere. But the point is, even those emergency beds you are talking about, must be bought from the market. And a time comes when they are not there to be bought, not because we cannot afford them, but they are not just there in enough numbers to serve everybody.
So let's look at now, just as we move the conversation into in Naivasha this morning, Prof, with the other governors, you're discussing BBI. The last time we spoke with you here, it was before the release of the BBI report. Now the report is out, and that's why the governors are meeting today, and you expect to host the president and the ODM leader. Some of the reports that are coming out of there is that there is consensus on some areas, and there is sort of some differences that are emerging, even amongst yourselves in some areas. What are your prospects of seeing some proper consensus building, not just among the governors, but among the other interest groups as well, as we head towards a referendum?
The prospects are very good. The discussions are very healthy. The differences are being ironed out because they help to explain better what needs to be improved in the BBI report. And I think yesterday we had a wonderful day. I think we're going to have a wonderful day with the Prime Minister today. I think we had very productive discussions. I think we realized the kind of things that people didn't understand well or have not put properly in the BBI. I think we have drafted these proposals to the BBI team. I hope they will take them into consideration, and I'm quite sure that when we go to referendum, we are likely to have a higher consensus than expected before.
Okay. But my worry, though, Prof, and I've got to say this, is as these conversations are happening, for example, the Council of Governors has enough muscle to sit down and even welcome the former Prime Minister and the President to a table and have the conversation. How about the other interest groups that may not have enough muscle to even get the ear of the principals or the task force, and maybe they have issues that they'd like addressed? For example, persons with disabilities, they had a press conference some time back, and they were raising issues about what's contained in the BBI report. Where would their place be in voicing their concerns and getting their grievances addressed?
Mind you, even among the Council of Governors, we deal with issues of persons with disability. I think I would say myself that even before the issue of persons with disability became broad national conversation, as a member of parliament myself, I was responsible for promoting a lot of issues with persons with disability. You may have to have a conversation with Isaac Maura, he will tell you.
Yep.
And I think that among the Council of Governors, there are counties where issues to do with persons with disability have been put centrally in this conversation, and opportunities have been made available at the county level for these conversations to be brought within what we as governors are doing, so that we don't wait for persons with ability to raise the issues themselves. But I think we as representatives of these people with county ability must also take up these issues. And I know yesterday, for example, some of those issues were ventilated during our discussion.
Governor Nyong'o, we thank you very much for speaking to us this morning. We hope even after this meeting, we will be able to invite you again and we can expound on some of these conversations.
Thank you so much, man. Have a good day.
You too. Have
Thank
a
you,
good
sir.
day.